It crashed and burned.
The Idaho Senate rejected the state's largest appropriations budget bill of the session Thursday.
I knew that there was some that were against it on both sides, but I didn't think it would die the death that it did.
Senate Bill 1375, the $5.7 billion Health and Human Services maintenance budget for fiscal year 2027, funds everything from foster care and Medicaid to psychiatric hospitals and mental health services, keeping critical programs running for thousands of Idahoans.
This is the granddaddy of all of your appropriation bills that you'll hear this year.
But the bill didn't just fail. More than 2/3 of the Senate voted no.
I don't think this is sustainable for our state at the rate we're going here with the health and welfare.
Opponents like Senator Glenada Zeiderveld have concerns the state is too dependent on federal dollars, and she's worried about long-term sustainability.
We're seeing changes of percentages where the federal is starting to decrease the amount that they're paying on a lot of the different programs, and the state has to increase their percentage.
The Department of Health and Welfare and the State Independent Living Council are the two government agencies covered by the bill. Senator Melissa Wintrow worries the ongoing 5% budget cuts for the two agencies will keep costing Idahoans services, jobs, and in some cases, their lives after the assertive community treatment program with personalized mental health services was cut by Health and Welfare and Medicaid contractor Magellan.
The program was canceled December 1, and I got word today that 4 people now are associated with deaths of those teams being cut.
But Senator Jim Guthrie called this a, quote, defining moment in the state's history and drew a sharp line between today and the last time Idaho faced cuts this deep towards the tail end of the Great Recession.
Today's financial pain, in my opinion, is in large part self-inflicted.
Guthrie, a 16-year Idaho senator, pointed to last year's historic $450 million in tax cuts, passed before a realistic revenue number was set, as the root of the crisis.
We're not tightening our belts at all. We're not taking a pay cut. We're not compromising our benefits. We are tightening the belts of Idaho citizens, and the feedback from my constituents is that they are not happy about it. You know, this issue gets painted as a conservative, liberal issue. It's really a human issue. But as for me, I'm comfortable with how my no vote will define me.
Senators commended Guthrie's remarks.
So, Senators, if there was a time when I wanted to stand up and give a standing ovation to a testimony that was given on this floor, it was just a moment ago by the good senator from 28. I hope you all paid attention, because he was spot on.
Killing the bill in a 10-25 vote, sending this budget back to the drawing board.
This is where we're going to have to go do some talking and some compromising and seeing what we can do.
Senator Cook says it's likely a new and revised maintenance budget for Health and Human Services will hit the state's Joint Finance Appropriations Committee Monday. Of course, anything passed out of JFAC will need a Senate and House approval, so this process really starts all over again, Justin.
Aspen, yes, we are still pretty far away from sine die. Thank you for that.